Dr. Sebi Cure for Herpes, a simple and effective guide on how to naturally cure the herpes virus with proven facts. Includes Dr. Sebi Alkaline Diet Plan, written by Darell, narrated by Kraayvanger and Tom Chandler.
Introduction. Herpes is a latent, dormant virus that can enter the body through simple skin-to-skin contact, which is because the opportunistic bug can take advantage of even microscopic points of entry. Condoms can prevent infection, but not always. In truth, unless you become a celibate monk and move to a monastery by yourself, you'll never be 100% safe. There are two kinds of herpes simplex virus, HSV1 and HSV2. Both viruses have different forms of behavior. HSV1 embeds itself, usually, in the trigeminal ganglion, facial nerve cells, while HSV2 prefers the sacral ganglion, going after your private parts, genital herpes. The virus is extremely handy and has been reported in various parts of the body. Although these are its preferred areas to inhabit, it's certainly possible to acquire HSV1 in your genitals and HSV2 on your face. However, such incidences are uncommon. The virus stashes itself into these nerve cells. When the conditions are right, it starts to replicate itself again, attacking your healthy cells and traveling upward, emerging as a red pimple-like sore before your body fights it off. Sometimes, when the virus wakes up, you'll experience mild flu-like symptoms, including a fever and sore throat. That's why cold sores are called that way. Besides, herpes typically creates onset symptoms upon initial infection. So, if you contact herpes the first time, you'll not only come down with a herpes sore on your genitals or your mouth, but you'll also feel sick for several days. However, it does not always occur, and as it happens with many things herpes-related, it seems to be primarily dependent on your body's immune system. Overall, herpes is one of nature's most successful viruses. It exists in our bodies forever. It is extremely easy to contract, and it, typically, does not harm or kill the host.
Sample complete. Ready to continue?